Hello, my name is Nikki and I'm an oncology dietitian that is based at Princess Alexandra Hospital in Harlow. I want to talk to you about your diet now that you've completed your treatment. Food is such an important part of our lives and eating well brings many health benefits. I am not suggesting that you become a vegetarian or vegan, and if you are or do, that's fine. But we do recommend that you base your diet on plant-based foods. This means that 50 to 60% of your diet should come from foods such as vegetables, whole grains, pulses, starchy carbohydrates, and fruit. We also recommend that you have dairy, milk, yogurts, and cheese, all the plant alternatives such as soya, oat, hemp, and nut milks, as all of these can provide essential nutrients such as protein, calcium and B vitamins. But be aware though, some do contain a lot of fat, so opt for the lower fat versions. There are, however, things that we would recommend you reduce in your diet, and these would be alcohol, limit this as much as you can. Processed meats, so that means any meat that has been salted, cured or transformed by the use of chemicals and preservatives. So that would be foods like ham, bacon, gammon, salami, hot dogs, frankfurters and some types of sausages and burgers. Red meats, again, limit them, such as beef, veal, goat, pork and lamb. Aim to have no more than 3 portions of meat or processed meats combined per week. That's less than 500 grams or 1 pound in weight. We do recommend that you have other good sources of protein in your diet, and that can come from foods such as nuts, pulses, eggs, fish, chicken or turkey. We also encourage you to limit your intake of fast foods and other highly processed foods that are high in fat, salt, starch and sugars. These would be things like chips, crisps, salted snacks, cakes, biscuits, cookies, some takeaway meals, sweets and chocolate. The reason being, eating lots of these things makes managing your weight very difficult because they contain a lot of energy and not much good nutrition. It really is important to stay at a healthy weight. We also recommend that you cut down on your salt intake, since this can raise your blood pressure and damage the lining of your stomach. It is thought that the average person in the UK is having more than 8.1 grams of salt a day, and the recommendation is to have below 6 grams. And that is about 1 level teaspoon per day. Staying well hydrated is a really important aspect of your diet. Drinking enough liquids helps to ensure that all bodily functions are able to take place as normal. Water, milk, tea, coffee, fruit juices, soup, they all count. A typical glass or mug is around 200 ml, and we suggest you have at least 8 to 10 of these daily. As well as eating well, it is important to stay active. This too has many health benefits. It helps to reduce your fatigue, keeps your immune system working well, reduces risks of other diseases such as high blood pressure, heart disease, diabetes and obesity. It keeps your heart and lungs healthy, improves your muscle strength and reduces muscle loss. It can help to reduce anxiety and depression. It can improve and lift your mood. It can help you to maintain that healthy weight. If you're unsure if you can exercise, check with your doctor how active you can be. Aim to be active and have a varied diet every day with lots of different colours in it, so that your body can get all the nutrients it needs for a healthier and happier you. Thank you for listening.